Good afternoon to our viewers. Thank you for joining us today as we celebrate today Mammography Day. Welcome. October is celebrated as Breast Cancer Awareness Month. Each year, the aim is to build continued awareness on a topical issue. Ladies and gentlemen, my name is Donna Brown, and welcome to the Consulate General of Jamaica, New York's Let's Talk Breast Cancer Forum. But what is breast cancer? It is noted as a cancer that forms in the cells of the breast. It is one that can occur in men and rarely in men and in women. Symptoms may include a lump in the breast, bloody discharge from the nipple, and changes in the shape or texture of the nipple or breast. Our program today features two dynamic females in the person of Mrs. Alsion Wilson, Consul General of Jamaica in New York, and Dr. Camelia Lawrence, Director of Breast Surgery, Central Region, Hartford Healthcare, as they talk breast cancer. Consul General Wilson will today share with us her story on breast cancer survival and how she maintained the balance. Dr. Lawrence, in her capacity, will provide us with a wealth of knowledge on the importance of early detection, what to do next, and how to navigate the detection and what to do as it relates to transition from pre to post diagnosis. Let us now get into the conversation with our distinguished guests. Good afternoon, ladies.
Good afternoon, Ms. Brown.
Hi, Consul General Wilson. How are you doing today?
I am doing wonderful, thank you. And thank you so much for being our moderator for today's forum.
You're most welcome. We want to thank you again for coming on here today to join this forum to share with us your story. So I'm going to ask you right off the bat, firstly, how did you learn about your diagnosis? And in that moment, how did it impact you?
Okay. It's a long story. So I learned about, well, before I inform you of how I learned about my diagnosis, I would have to kind of walk you through what transpired before I received the diagnosis. So, 2 years ago, because of COVID, I missed my mammogram screening. And then I rescheduled my appointment for about a year later, and something happened on the very day that I was scheduled for my appointment, and I wasn't able to make the appointment. After which, maybe about 2 months or so later, I started feeling just some like pins and needles, kind of pricking at me in my right breast. Didn't pay any attention, but I scheduled an appointment for my mammogram. So I'd gone 2 years without doing my screening. So I went, I took the mammogram. I received a call maybe about 3 days later asking me to come back. They wanted to reschedule me for another mammogram of my right breast. They didn't tell me why. And so I went, I scheduled the appointment for the very next day. And I went, took the mammogram. They asked me to stay back for a sonogram. And I became a little nervous because I realized that persons that arrived at the hospital way after my appointment, they were, leaving before me. They did their mammogram and then they were out the door. So I was wondering, why was I still there? And so I took the sonogram. They asked me to wait a little bit. I became a little emotional. I started asking questions. I was there for about 4 hours. And so at that time, a doctor came in and told me that they saw something, wasn't sure what it was, and wanted to schedule me for a biopsy. And of course, I scheduled the appointment for the biopsy right away. Took the biopsy, and about 7 days later, I received a call from my doctor. And she scheduled a Zoom meeting. And it was at that point I realized that something was wrong. She first scheduled a Zoom meeting for the same day. When she got on, she says, how are you doing? And I said, I'm fine, but I'm wondering why am I on Zoom with you? And she says, well, Consul General, if you should receive a bad news, this is the bad news you would want to receive. And I said, I'm not following you. And she says, well, your results came back and you have what's called DCIS. And I said, what in Jesus' name is that? And so while she was talking, I started Googling. Google is my best friend. And I said, so it means ductal carcinoma. And so what is that? And so she explained to me that it was stage 0 cancer. And after that, I don't know what happened. I don't remember what happened after that. I became a little emotional, just asking a lot of questions. And I called my husband and, and he calmed me down and asked me to come home right away so we could talk about it. And, so yeah, I didn't go home right away. Everything was a blur. I got home maybe about 7 and he started calling to find out where was I and so forth. And so I got home and, and he said, you know what, let's pray. My husband is very spiritual. So he says, let's pray first. And so he prayed. And then after that, he said, well, you're going to be fine. So we just have to figure out what's next. Now, you mentioned balance. I don't know how I found balance. Dr. Lawrence, who's on with us, is my doctor. And she, I believe, helped me to navigate how to put together the treatment for me. I don't think I still haven't found balance yet.
All right. So, but you are navigating, and to this date, we see where you have not let your diagnosis and what you have been through stop you from being who you are and who you have continued to be. Mm-hmm. So having found that out in those initial stages, what steps did you take? What sort of coping mechanisms did you employ thereafter, learning that you have this condition?
Right. So the steps that I took was first, I did a lot of research. I was always Googling just to figure out how this is going to affect me. What steps that I need to take to get through this, and researching doctors. At first, I decided that aside from my husband, I wasn't going to discuss it with anyone. So I didn't tell anyone. And I think I can safely say that at this very moment, many persons that are probably watching did not know, they weren't aware that I went through this process. I received my diagnosis around my birthday in February. So, I just, I wanted to ensure that I found a doctor who I could connect with, right? And so that was the first step. I discussed it with my husband. I decided that I wanted my doctor to be, number one, a female. My husband said that he would prefer if my doctor was of Jamaican background, Jamaican heritage. And I had agreed with him because I thought that if she was, Jamaican or of Jamaican heritage, she would understand not only my background, but what my daily, how I navigate through my daily functions. Of course, Donna, that we carry a very large portfolio here at the Consulate. And so I couldn't just very well drop everything and, and forget about my responsibilities and just focus on myself. So I wanted to find someone, a doctor that would understand that. I wanted also to be in a hospital setting that speaks to me. I wanted the hospital to feel like more like home and less of a hospital feel. And so I started researching. Luckily, and in fact, I had met Dr. Lawrence before, maybe about 2 years before, and did not remember that I had met her at an event. And she also participated in 2019 in our Consulate General COVID-19 forum, and I still didn't remember. And so, I think that this is all, to this very day, I believe that, the Spirit of God help to myself and my husband, to find our way to Dr. Lawrence. One day I had a conversation with a friend of mine, Keith Grant, and he picked up that something was wrong and kind of pulled it out of me. And so I told him what was going on. He says, I have the perfect doctor for you. And I said, if she's not Jamaican, I really don't want to meet with her. And he said, she is Jamaican. He told me her name, and I remembered I'd met her before. And I believe I called her the next day or something of the sort. And she then kind of prepared me for what's to come and then planned everything with me.
So having said that, it is important that once you get this information, you're diagnosed, it is important that you have a doctor that understands you, someone who is going to be there with you to guide you along the way, because it cannot be an easy transition, because today your life is okay. You're going about doing your daily routines. You get this information and you're like, what do I do now? Who is going to help me along this journey? Because this is now a new path for you. You've never been here before, new roads to trod, and you're like in the middle of nowhere. So you need to have that guide. And it is good that you found a doctor that meets all the specifications that you outlined. And now, because I've seen you, you're here, you're there, you're everywhere, you're doing it all. You have given everything, even though you're going through so much. And it says a lot about you as a person and a lot about your character. Dr. Lawrence, thank you for being here today. What I want you to do first and foremost is to enlighten us on the significance of having a mammogram done, and tell us what are some of the things that you see persons do when they come for a mammogram, especially first-time persons.
Well, I just want to commend our consulate for her bravery and how she handled her diagnosis. You know, I kept looking at her throughout the months of February leading up to her treatment and the workload that she carried. And, you know, I knew what was going on, but I knew a lot of people were looking at her, perhaps thought that there was nothing wrong. And I was just amazed by how she juggled it all. There were moments that I tried to counsel her to slow down a bit and delegate so that, you know, you can take care of you. Screening mammography is crucial. You know, I may sound like a broken record, but I often say, I can't say it enough, that mammography saves lives. And as anecdotal in the consulate experience is the fact that she went in for her mammogram. Her breast cancer was caught early, stage 0 at its earliest stage, when it's most treatable and it's most manageable. There are a lot of myths about mammography, all of which can be dispelled. For the first time individual that's coming in for screening mammography, there may be apprehensions regarding pain and discomfort. There's always questions about the fear of finding something. You know, there's some people who live by burying their head in the sand and they don't really want to know something is wrong. But I often emphasize that fear is not an ideal strategy when it comes to breast cancer. Because what we do know is that breast cancer caught early is very treatable. It's so important for us to, not just for ourselves, but for our girlfriends or moms or sisters and our aunts, to encourage folks to get their mammogram, especially if there's a family history. If you have a family history of breast cancer, you're at an increased risk over the average woman. And we'll talk a little bit more about that later on in this session.
Definitely. Thank you so much for that, Dr. Lawrence. But based on what CG has shared with us here today, give us an analysis. For example, did she do the right things in the initial stages? And what else, if there was anything else that she could have done?
Well, absolutely. She acted on it right away. She's acknowledged the fact that she had missed her mammogram. And that happens to so many women. You know, I often think of women as, you know, being, they are managing home, they're managing, you know, supporting family, their spouse, maybe elderly parents, and they tend to put their own health on the back burner. So it's not unusual for a woman to miss her mammogram. And that's why it's so important for us to serve as a reminder for each other. That's, you know, to get your mammogram done if you've missed it. So once she scheduled her mammogram, and she was made aware that there is an abnormality, she did not delay care. She went ahead and she followed through in the medical recommendations to have the additional diagnostic images that were warranted. In addition, once the biopsy was recommended, she got the biopsy done. And in terms of scheduling an appointment and consultation with a clinician to initiate therapy, she did that right away. And what I liked about CG's description is that she utilized her resource. Her friend, I got to her through a mutual friend, Keith Grant, who's a colleague of mine, who directed her to me for care. But sometimes when women find out about this process, that there's a tendency for someone to want to keep it secret and private. But if you cast a wide network and other people know you're going through it, the overwhelming majority will want to help you navigate the process. And it's so important that you get plugged into a space that doesn't just do breast cancer as a one-off, that they are committed in a multidisciplinary setting to the management of the breast patient. And an institution such as Hartford Healthcare has structured programs in order to facilitate that level of care.
Great, because I know that persons, as you stated, and it is true, we're often told or we hear that, oh, when you go to do a mammogram, it was so, it was painful and I was so uncomfortable and the machine was cold, and you hear all the negatives.
Yeah.
So it's kind of like, persons are fearful of having to go through that process, and they're like, listen, I'm not going to do it because of all of this. So they keep putting it off and they put it off and they put it off.
Yeah.
And for some persons, unfortunately, the postponement allows for, if there's something there, then late detection, and then there's nothing or little that can be done to prolong life.
Correct.
In that aspect. So it is, early detection is very important from what I'm gathering.
Yeah, from the statistics that we have available, in CG's case, a woman that's diagnosed with stage 0 breast cancer that goes through the recommended treatment protocol, the 5-year and beyond survival is about 95 to 99%. In contrast to a woman who's diagnosed with stage 4 advanced stage breast cancer, that number dips to about 25%. So you can see the drastic difference in terms of survival between early stage breast cancer and later stage breast cancer.
Right, thank you for that. Consul General, after being diagnosed and you got your doctors and everything, what treatment recommendations were given to you based on your specific situation? Because we know that all diagnoses are different. So for your particular situation, what was your treatment option?
Right. So the first advice that I received from Dr. Lawrence was to cut back on my workload. And that was very, very hard to do. And so we had to figure out first, before I even get into the treatment process, is how to kind of cut back on my workload so that I could prepare myself mentally and physically for my treatment. Dr. Lawrence did advise me that I needed to have surgery. There was just no getting around that. So I needed to prepare myself for surgery. That was difficult for me because after surgery, then I thought that maybe 3 days or 4 days later, and I literally, and I know persons that are on live with us at the moment going to say, she's crazy. Well, Dr. Lawrence is here with us today and she can attest to this. I thought that I was going to be able to get back to the office in 4 days. And so Dr. Lawrence said, no, you would need to be home for 2 to 3 weeks. And so I started negotiating with her because 3 weeks was not an option. We were celebrating Jamaica's 60th independence, and we had a lot of activities on the calendar. We had the pen relays, which I didn't want to miss. We had our church service coming up and so forth, and our Independence Gala. And so we had to figure out how in between these activities to go in for my CAT scans and so forth, and to do the counseling with Dr. Lawrence, and then to get to this surgery. And so we planned the surgery 2 days after the launch of our church service. You will recall that, well, you weren't here at the time. Mrs. Prasad at the time was my assistant, who actually helped me quite a bit as well to schedule my appointments with the doctor. But 2 days after our 6-day launch, Dr. Lawrence says to me, you must have the surgery now. We cannot wait any longer, or else we're going to run into trouble. And so 2 days after the launch, I went in for the surgery. And in fact, one of the things that I needed to do as well was to, although many persons were not aware that I was going through this difficult or challenging time, I still had to figure out how to, talk to 2 or 3 friends outside of my husband, because my husband was doing everything. And so there were times that, I just fell apart. And I had to figure out how to keep it together. So I would call one friend and say, I am just not well. Now, what was surprising to me is, when I started calling these persons, I started to find out that there were persons within my circle that was going through the same thing, and they hadn't said anything. Or persons that had breast cancer last year or the year before, and they hadn't said anything, and I wasn't aware. So they were also able to advise me on what to do, deep breathing, and so forth. After surgery, I was down for about 2 weeks. I made sure that I didn't stay in bed. I followed all the advice that Dr. Lawrence gave me. And then we started to figure out after surgery what next to ensure that, I don't have a recurrence.
I must ask you though, did you feel positive, and with all that you've been through, and what has kept you positive to this day?
Right. So I am a positive person by nature. My former assistant, Mrs. Prasad, who I hope she's on with us, will tell you this. She always says to me, CG, I don't know how you do this. I believe that, positivity brings you to humbleness. And so because I'm a positive person by nature, the disease, once I was diagnosed, although at times I felt a little down, and some might call it depressed, I wasn't, once I felt it and I went down, then I just figured out a way to bring myself back up. What has kept me through, I believe you asked what has kept me through. What has kept me through is a lot of prayer, because I kept saying to myself, I still have a lot to do. I'm not ready to die. I kept telling myself these things. When you receive the diagnosis, the first thing you think of is death. You just immediately, I'm not sure why, maybe Dr. Lawrence can speak to this, but, I thought that, oh my God, why is this happening? I have so much left to do, and I'm just not ready to go yet. So you find that strength within you, that fighting spirit. Sometimes you have to figure out how not to think about the disease. This is very important, how not to think about it, whether it's, by way of, finding a support group, your friends, going out, going shopping. I had a lot of activities on my calendar, so it kept me busy. So for a lot of times, I just wasn't, there mentally in the space where I felt, like the disease was taking control of me. I didn't allow the disease to take control of me, as a matter of fact. And I have to say this, and at any time that I felt that, I wasn't in control, I would call Dr. Lawrence and, just ask her, what should I do, and so forth, and she would guide me. So it's very important. It is very important for you to find a doctor once you're diagnosed, for you to find a doctor that you connect with, and that doctor also connects with you as well.
Thank you so much, TG. Dr. Lawrence, given what the Consul General has outlined today, what sort of advice would you like to offer to people, not just female, but female and male? And additionally, how important is early detection?
You know, I would start by underscoring the screening guidelines that we adhere to here. And I'm glad you mentioned men, because while breast cancer is predominantly a disease of women, men can be impacted as well. In the United States, we see about 2,000 to 3,000 cases of male breast cancer yearly. And the recommendations for screening here is that every woman, an average risk woman, should commence screening at age 40. However, if you do have a family history of breast cancer, that age may be very different. For example, the majority of breast cancer that we see, we don't know what caused it. It falls under the category of sporadic breast cancer. But about 10% of breast cancer can be due to a hereditary mutation. And this is a change in your DNA makeup, nothing that you had control over, and most likely you've inherited from mom or dad. The two most commonly known genes that you perhaps have heard about, they're very prevalent in the media. Angelina Jolie brought light to the BRCA1 and 2 mutation, is that it increases a woman's risk substantially for breast cancer. We're talking about 85% or more for breast cancer, as well as ovarian cancer. And I often tell my patients who have this mutation is that it's not a matter of will I develop breast cancer, but when will I develop the disease? So because of that, the current recommendations for women who are carriers of that mutation is that you begin your screening mammography as early as age 25. But here's another important piece, is that knowledge translates into vigilance. Because if you do know that you have that mutation, there are risk-reducing things that a woman can do to prevent herself from developing a breast cancer. So that's why I always emphasize that it's important to know your family history, because it may dictate an earlier age to begin screening for you. But I think it's important for the average woman to, one, be aware of the disease, and two, be aware of the common symptoms that may present. It could present as a lump in the breast. It could present as skin changes on the breast. It could present as nipple retraction. It could present as skin thickening or redness. It could present as, nipple inversion, the cancer pulling on the nipple so it's inverted. So any change within the breast, I often tell women it's best to have it medically evaluated. Allow a clinician to tell you that this is a benign change and nothing for you to worry about. And in some cases, imaging is recommended or needed in order for you to be able to rule out an underlying malignancy. So those are some of the characteristics or changes that you may look for when you think about diagnosing breast cancer. But here's a piece that takes us back to the latter part of your question regarding early detection. And it is the fact that the majority of breast cancer that are found, they're identified on mammography. Because breast cancer not only present as lumps or visible changes, it can present as a distortion in the tissue. It can also present as microcalcifications within the breast. And to be honest with you, even myself as a clinician, I'm a fellowship trained breast surgeon. This is all I do every day, all day. I will not be able to appreciate on clinical exam a distortion in the breast or microcalcifications within the breast. The only way those can be found is by getting your mammogram and for us to be able to take a look at those pictures so that it can be identified. And once those changes are identified, generally a biopsy is recommended to clinch the diagnosis. So we harken back to our original statement that we discussed when we started out today, which is that early detection is paramount. And it's very early, it's very important for you to get your screening mammogram as well as your breast exam so that you can identify the cancer at its earliest stage when it's most treatable. And I'll just end my little section here with an uplifting message as well, in the sense that while breast cancer is a commonly diagnosed cancer among women, women are going on to survive this disease. In the US alone, we have over 3.8 million breast cancer survivors, just like Consulate, Alsion, Wilson. And that's because they had their disease diagnosed early and they followed through on the treatment recommendation. So as you can see, it's a very manageable disease.
Thank you so much for that. What I want you to also elaborate on is this new 3D technology in mammography that is happening. I did one when I did my first mammogram. I must admit it was scary. Yes, I almost passed out when I saw everything, lit up on the screen and they can show you everything. You see everything.
Mm-hmm.
Tell us more about that technology and what it does and how it helps.
So traditionally, we've always employed the 2D mammography, which is sort of a compression view. The tissues all compressed together and you get a singular image. My colleague gracefully described a 3D mammography as before you would take a picture of the forest and you would look at the picture and do the best you can to evaluate what you think is going on in the forest. But with a 3D mammography, you're not only taking a picture, you can actually walk through the forest and you can look at the different types of trees and you can look at the changes within the forest. And that allows you to give more information about the woman's breast. Now, why was 3D mammography considered? Why is it important? And that takes us to the topic of breast density. There are 4 categories for breast density. From a completely fatty replaced breast to a breast that's heterogeneously or very dense. And why the reason this is a concern is because density shows up as white on mammography. But what else shows up as white? Breast cancer. So in women who have dense breasts, the breast cancer is not easily identified on mammography because the cancer that's white can blend in very easily with the background that's also white in the dense breast. So what 3D mammography allows us to do is to scroll through the breast tissue so that we can identify any changes, even small changes within the breast itself, and be able to identify the cancer at a smaller size and hopefully an earlier stage.
Right. So we're seeing, just to go back, normally it is recommended that persons do their first mammogram when they hit that 40-meter mark.
Mm-hmm.
Or you're finding now that people as young as their early 20s are being diagnosed with breast cancer.
Mm-hmm.
So guide us. What do you tell them? Because they will say they don't have the regular symptoms and doing a mammogram is not for them. So,
right. And that a part of that has to do with family history as well. The current guideline is age 40 for the average risk woman, but if you have a family history, even if there's not a known mutation identified, your need for screening may start even earlier. And you're absolutely correct that we're now starting to see breast cancer among younger women, especially among younger Black women, also with a more aggressive tumor biology. So what I often tell women is, independent of your age, if you've noticed any changes within the breast at all, that it's worthwhile, it is prudent for you to seek medical attention right away. But based on the available data, in terms of number needed to treat for the study to be effective from a population health standpoint, 40 seem to be the best age cutoff for the average woman. But that doesn't mean that if a woman is at an increased risk or a stronger family history, that she cannot be evaluated at an earlier age.
Talk to us about diet and exercise, whether you are diagnosed or not.
Yeah.
How important is it?
Oh, it's very important. I often say, motion is lotion for the joints. We know that not just breast cancer, but many cancers are associated with obesity, right? Obesity increases your risk for malignancy. So does tobacco use. Cigarette smoking, tobacco smoking does increase your risk. So I tell my patients, the encouragement is always for you to lead an active and a healthy life. So all things in moderation. It doesn't mean that you cannot consume certain foods, but it's very important for you to maintain a healthy BMI. And one way in doing so is by employing some form of physical activity, maybe something as simple as walking. For example, I no longer run like I used to because of the impact on my knees, but I often try to walk as much as I possibly can. And you do get the health benefits from a robust walk as well. So whatever modality or method of exercise or physical activity that you can fit into your lifestyle and your schedule is always strongly recommended.
Thank you. And I know, Consul General, that you said she did everything spot on from beginning to end. Consul General, talk to us about how you incorporated your exercise and adjusted your diet.
Incorporated my exercise. Ms. Brown, the truth is, since the onset of the COVID-19 pandemic, I have not entered the gym. I have not have not done any exercise. And that's why balance is my favorite word going into next year. Again, if Mrs. Prasad was here, she would tell you that I signed up at the gym down the road, but never could find time in my schedule to go to the gym. So I haven't been exercising at all. And in fact, persons have noticed actually that I've gained weight. I was always a very petite person. So the lack of exercise, I've gained weight. But I promised you, and I promised Dr. Lawrence, that I am going to start back my exercise routine, and I am going to start it back. I don't plan on having any more relationship with this disease ever again, and so whatever it takes for me, for me, it was really weird because I don't have a family history of breast cancer. Dr. Lawrence was, she said, we've seen this before, but my goodness, I have many females in my family, but I was the first to be diagnosed. So we don't know where it came from, and so I want to ensure that it doesn't happen again. I'm sorry, what was the next question? You had a follow-up.
Diet.
The diet, okay. So, luckily, my diet is always, very good, and it's bad. Bad because I don't have time to eat. So you'll notice that I don't eat breakfast, and you're always asking me, CG, what are you having for lunch? And I don't eat lunch either. What I do though is I always have my water with my vegetables and fruits, and I sip on it all day. I do have dinner because my husband is a cook, and he cooks very, very, very well, and so I always ensure that I have dinner with him when I get home. So my diet is dinner, and dinner is always something very healthy, whether it's steamed fish. I love steamed snapper, so steamed fish or something of the sort. Everyone knows that I love my ackee and saltfish, and with boiled food. I'm not a fried food person, so I don't eat fried chicken or fast food. I'm not I wasn't ever a person that indulge in these food that you're not supposed to be eating. I want to put it mildly. So so what I plan to do now, coupled with the exercise, is to start a juice diet, and just to detox. And then from the juice diet, then I'll go into something that I love and I used to have at least 4 times a day before my husband, before I got married, which is a smoothie. So I normally have 4 smoothies, one for breakfast, a snack, then lunch, and then one for snack again, one for dinner. I'd stopped that because my husband cooks a lot. So I'm going to now incorporate back smoothies into my diet.
Thank you for that. Dr. Lawrence, just a little bit more. Persons will say, well, Jamaicans, we have a lot of saying. I know I heard old person says, something have to carry you home. However, being diagnosed with cancer, you have to change your diet. Am I right? Tell us
Well,
more about that.
it depends on what your diet was made of before the cancer diagnosis. You know, I have patients who've maintained very healthy diet. They have a BMI of 21 or 22. They're marathon runners, and yet they've been diagnosed with breast cancer, right? So it's very hard to just harp on just the diet and exercise. But I often say all things in moderation. We have the different food groups. And I think we all have the capacity to really understand and may require some behavioral modification regarding how much we're consuming and of what food groups. So it's always a good idea to introduce more fresh foods and vegetable. Like Consulate General, I love the Alsion saltfish. It's one of my favorite meals. You know, food ties us to our culture. And for me, it's the Alsion saltfish with a boiled dumpling or a piece of yam. My dad does a really good job of making it. It takes me back to home. It takes me back to my childhood growing up in Jamaica. So there are memories associated, but I have to also take in consideration that if too much of anything is never good. So I'm always monitoring how much of it I consume, but it doesn't mean that I abstain from it altogether. And as I mentioned before, I do employ some exercise regimen, drink a lot of water. There's a variety of methods that you can employ to make sure that you're maintaining a healthy body mass index to decrease your risk, not just for cancer, but also for heart disease and diabetes and hypertension. There are all these health benefits associated with healthy eating and a healthy lifestyle. So it's crucial. And I just want to echo a comment Consulate General made, which is that she has no family history of breast cancer. And the majority of women who we see with breast cancer, they are the first in their family. So it's very important to understand that because you don't have a family history of breast cancer, it does not mean that you're at risk. You're not at risk. We are all susceptible to this disease.
Yeah.
Important. The psychological impact of going from today I'm fine, it's just another day, and then you're hit with this news, you have breast cancer. The impact on you mentally. Take us down the path of things that you have noticed, things that you've seen in general as it relates to persons after they have been diagnosed with breast cancer.
You know, the spectrum varies. You know, there are women who they come in and they're Dr. Lawrence, I was diagnosed with breast cancer. I'm here to discuss treatment. They are ready to proceed with surgery if indicated. If there's chemotherapy, whether it's neoadjuvant, which is before surgery or after, they come in prepared and they're ready to go. And there are women who fall apart. You know, it's emotionally devastating. The word cancer is a fearmonger. And our minds automatically, for most people, you start thinking worst case scenario. Does this mean a decrease in my life expectancy because I have this cancer? So I see the gamut of presentation. And my job as a clinician is to realize that I'm not treating just a cancer, right? I'm treating a person, a human being. There's somebody else behind this disease. So I tend to focus on that in terms of making my connection with my patient. I get to know my patient. You know, one of the things I do in the operating room is I usually know what music they're more inclined to listen to create a space that's very calming and welcoming for them. And I encourage them to bring family members in, their support infrastructure. It could be a girlfriend, it could be a spouse or a sister or a mom, so that they have a support infrastructure in place to help them navigate the treatment. So the emotional piece of it varies. And within the most comprehensive breast program, for example, for our program within Hartford Healthcare, we actually have a role that's called the breast health navigator. And our navigator touch base with every single one of our women who is diagnosed with breast cancer. And the primary goal is to provide that supportive infrastructure as they navigate the care continuum.
A lot of persons are watching. How important is and I know you've mentioned it, support system and what kind of support system is best. We're talking in general now because you might have persons logged on who are going through this. They have no support system. They don't know what a support system is. So just give us an idea. Give us cast a net.
Yeah, I mean, your support system is very important. You know, from a clinical standpoint, you need to be a part of it. You need to identify your team, just as a consulate did, where she identifies somebody who she connects with, somebody who she thought would be able to relate to her as an individual. You need to identify a treatment team, and a team that has a comprehensive approach to breast cancer management. Because what we do know about breast cancer, that the surgery is only part of the algorithm. There are three main arms to your treatment. One is the surgery, two is chemotherapy, which could be before surgery or after surgery, and the other component is radiation. Now, not all women will require all three components, but you need to be within a space where if you require those treatment, that you have access to it, that your team is in place. Within Hartford Healthcare, we have what's called a multidisciplinary tumor board. And it's an opportunity for all the different specialties all the different physicians from a different specialty. We get together once a week and we discuss every single breast cancer case, because we know that no two breast cancer is exactly the same. So it's no longer one size fits all. It's what we consider as personalized medicine. So we discuss each case and we develop a treatment algorithm that's going to best suit that woman's cancer. So it's very important for you to have your team, your medical team lined up, and that you're in good hands. But another very important piece of it is your family and your friends, your support infrastructure when you're outside of the clinical setting. It's so important that you have folks that you can talk to, that you can lean on, whether it's, just for conversation, it may be physical help. It may be the fact that you're going through chemotherapy, you're not able to prepare your own meals, or you may need transportation to and from treatment for radiation. So a robust support system goes a long way. Sometimes it may just be a second pair of ears at your clinical visit, so that there's somebody else listening to as well, so that you can discuss after, because you can come in, you can listen to the surgeon or the physician just speak to you, you get out of there and you forget everything. But by having somebody else there to listen, you can then go through it together, make sure you've understood what was being shared, and you have a clear comprehension of what your treatment choices are.
Great. Consul General Wilson, as we draw closer to concluding today's forum, tell us, give us something. We know you're a positive person. You have said you're a positive person. We have seen you being positive on a daily basis. How do you go through, and what advice do you have for a fellow female going through the same thing?
Right. So how do I go through? I start every day on a positive note, and then with prayer. Most times person will see me, even sitting here, I might have prayed 3 times while I'm sitting here. So I'm constantly, saying a word of prayer. I also lean heavily on my support team. And so Dr. Lawrence just mentioned that it's very important, if you're going through something like this, that you have a support team in place that can, assist you, a second pair of ears and so forth. I have a support team. And of course, Dr. Lawrence, who at first started out as my doctor, is now one of my closest friends, right? So, and I know I can call her for everything. I have a support team in place with a few females that I can call on for anything, even if it's just a difficult day that we're having here at the consulate, and I just need, to go over to the Kimberly to have a quick bite and a glass of red wine with someone. I have that person that I can call, and she will say, I'll be there in a heartbeat. You need to have that. That is just so important. I also, and I sometimes we'll see persons and they look okay, and and you think that they're okay and they're not okay. I went through that several times during my treatment. So I have that one person that I call at any time when I just feel like I'm not okay. And of course, that's my husband, Omar. And as soon as, and we have our own little code, he know when I'm calling because something is wrong and I want to talk to him about that. So we have certain codes that he knows that if he's in the office, if he's working, he'll step aside and pick up right away to talk, to kind of bring me back to the space that I need to be. Someone going through this, you need to find the space where you can really, if you're going through, if you have a stressful position where you can really decompress, because that's what happened to me. I mean, to this day, I firmly believe that it is stress that brought on this disease on me. And, Dr. Lawrence is the expert. I'm no expert. She can attest to this, but I really believe that it was stress. So the first thing that you really need to do is when you're diagnosed, if you have a stressful position, you need to figure out how to just breathe and decompress. And of course, I said it before, once you have, managed to calm yourself down, because you're going to cry, you're going to, feel very emotional at times, you're going to feel sad and so forth. But remember, the important thing here is to get yourself better, right? And in order to get yourself better, you have to find your way, you have to find yourself in the frame of mind where you can take charge of your health, and so that you can fight this disease. If you're just always emotional and, like Dr. Lawrence said, sometimes persons come in and you're giving them the information and you'll think that they have digested the information, but once they walk through the door, they'll remember a thing. That happened to me once or twice. But if you have figured out a way where, you can, like I said, I was always on Google, where you can, by yourself, Google the information, write down the information, talk to the doctor, ask them, is this the best treatment? I several times I asked Dr. Lawrence, do I have to have the surgery? Is that necessary? And then, when she says yes, I ask her, tell me why is it necessary, and so forth. Only you alone can take care of, can ask these questions, and so that you can figure out, along with your doctor, what's the best treatment for you. And then after the surgery, which I had, then, and as I said before, my goal is to ensure that this never happens to me again, ever, right? So after the surgery, you also need to have your plan in place where, and if you're like me, where I caught mine early, thank God, that you figure out how to have a structured, balanced lifestyle, that this disease does not recur.
Thank you so much, Consul General. While persons prepare their many questions, because I'm sure persons have questions, Dr. Lawrence, just give us some general information as it relates to breast cancer on a whole. Just give us something.
Yeah, I think we've covered a lot. So I'm so glad we're doing this. I think it's also important to emphasize the fact that Black women in particular, we're twice as likely to die of this disease. So there needs to be a sense of urgency. We need to sound the alarm. We need to encourage each other to get their screening mammogram, to seek medical attention for any abnormalities identified within the breast. And within the Jamaican culture in particular, there is a sense of secrecy, right? We don't necessarily may not want individual to know, but I would just like to share with everyone today that this is nothing that you brought on yourself. It's nothing that you have control over. There's no shame associated with a breast cancer diagnosis. The most important thing is that you are diagnosed and that you receive the appropriate treatment and that you're diagnosed as early as possible. So I would strongly, a few years ago, my girlfriend and I, Jill, we began this process of this bosom buddy, which is really identify an accountability partner, someone to remind you every year that it's time for your mammogram. It may be a combination of let's have brunch and then mammogram, or the mammogram and then we'll go to the spa after. But whatever it takes, just to have somebody to hold you accountable so that you can get your mammogram. We're seeing more aggressive type of breast cancer in Black women, a type of breast cancer known as triple negative, has a more aggressive tumor biology and an increased risk of both local as well as distant recurrence. So vigilance is absolutely important when we're talking about this disease, especially among Black women. So those are some of the messages I would like to send home in addition to screening mammography, is what are the things that we can do to support each other and to ensure that each other is getting their screening studies done. And once diagnosed, providing that support, creating a village of support around this particular individual so that they can navigate the care continuum. Because it's not always, the diagnosis itself is very difficult. But if you've had to go to all the treatment arms, chemotherapy followed by radiation, it can be difficult for some women, and you do need that village of support to help you get through it. And it is possible to get through this disease and have life beyond a breast cancer diagnosis, as so many women have been able to do.
Dr. Lawrence, I want to thank you so much for that information. I know Consul General is going to come in right now, and she's going to say something.
Yes.
Go ahead, Consul General.
Yes, thank you so much. Can I just also add to this? It is very important for us as females and as sisters to be our sister's keeper, right? What do I mean by that? For me, I think outside of my former assistant, Mrs. Prasad, and my husband, I mean, I didn't even tell my mom that I was going through this, right? And Dr. Lawrence, not many persons, and then when I've, kind of put my little group together, support group, and which was only about 4 females, not many persons knew that I was going through this. And so what I noticed during the time that I was, from February, I had my surgery on May 3rd, I believe, or 4th. Almost no one called me to say, how you doing? I received tons of calls, tons of messages, but it was from persons that are asking for a favor, to help them with something, to fix something. And, and you sit there sometimes and you go, oh my God, how am I going to get through this? Because you have to take care of your personal life, and you have to take care of, from the business perspective, you signed up for this job, you have to take care of folks in the diaspora that are calling you. But from time to time, I think persons should really step back and say to themselves, have I checked in on my friend today? I might be the Consul General, you see me running around to events, but am I really okay? So I, and I wasn't okay for several months, but, and almost no one picked up on it, that I wasn't okay. So what I do now is I will text person. You notice when I write my messages, even if I respond to a post on social media, and it's a female, I addressed her as beautiful. I always say, hi, honey, how are you? Whether I know you or not, if you make a comment, I would say, thank you, beautiful. It's just my way of, letting you know that, I appreciate you commenting. And trying to form that bond, even though I don't know you in person, with you, so that just in case something happens, you can send me a message and reach out to me for some help or some guidance or some advice. So it's very, very important for us to check in on our friends, even if it's just a Facebook or an IG friend. The other thing I want to say is Dr. Lawrence, and I know she's going to kill me. Now that I am on my way back to being 100%, I have approached Dr. Lawrence. Of course, everyone knows now that Dr. Lawrence is from Jamaica as well. And we're going to focus on, delivering in short order in Jamaica, a breast cancer institute, if you will, and where we can help to bring awareness. I had a conversation with Dr. Christopher Tufton, I believe about 3 weeks ago, and Minister Tufton informed me that one of the leading causes of death amongst our females in Jamaica is breast cancer. So it tells me that our ladies in Jamaica are not going in for their screening. And so they're receiving their diagnosis when the disease is at an advanced stage. And as Dr. Lawrence informed us early on in the segment, you have to get your mammogram, and so that you can, of course, be diagnosed early, and treatment can be well on its way, so you can get back to, to living a fulfilled life. So Dr. Lawrence and I are going to cover the plan where we're going to be in Jamaica to figure out a way how we can bring this awareness to our ladies in Jamaica.
Sounds good, CJ. I like the terminology to be your sister's keeper. Helping hands, all hands on deck usually produce better and more favorable results.
So in essence, Dr. Lawrence, there's no need for kicking and screaming as it relates to going for a mammogram.
None.
Just to know that everything is okay. So there's no need for somebody to be pulling you by the arm or the leg. And for me, I went and I had my mammogram. When I did my first mammogram, I was called to come back. And when I got the news, I sat on my desk and I was like, Lord, what is this? I started to, we all Jamaican people, we panic first and then, God works it out. So I eventually had to go back. But when I saw the word diagnostic, I was like,
wait, no, you forgot, Ms. Brown, you forget you came in to let me know. And that's when you found out that that's when you found out that I had surgery.
Yes.
And so I tried to calm you down because I went through the process back in February through May. And of course she's right. She was in pieces when she walked into my office.
Yeah. And the majority of time when a woman is called back, it turns out to be benign, to be honest. You can have a mammogram where there's overlying tissue, and the radiologist may just want some diagnostic views, what we call compression or cone views, to just better spread the breast tissue out so they can get a better view and to make sure they're not missing anything. So because you're called back for additional views on mammography, doesn't necessarily mean that you're facing a cancer diagnosis. So I'm glad you did go back and have those recommended studies done.
Yes, no kicking and screaming this time, but there were some tears, I must confess. Yeah. But in the end, the results were good and favorable. So from my experience, listen, it doesn't matter. Once you see a change, even if you don't see a change, mammogram is important. We cannot stress this enough, because oftentimes if you're not going through a situation or have never been through it, you may not see the significance of it. But a mammogram definitely is a priority for female, especially Black women.
Another thing, Ms. Brown, that I would advise ladies to do is, I believe I did my first mammogram, I believe at age 40. And I remember the doctor asked me, do you do self-examination at home and so forth? And the truth is we don't, I know I don't, so I said no, and so she showed me how to and informed me that that's something that I really should do. So what I have done, because I really don't, I never remember to do it, is I have my husband. So my husband, he'll, unbeknownst to me, and so if he feels something, then he says to me, because I remembered once he felt something and he says, oh, babe, there is something hard there. And so, if you're married, you have a fiance or boyfriend, maybe you can enlist them to help you, by just doing that little self-examination that you're supposed to do at home in between your mammogram. That's also very, very important as well.
Right. Dr. Lawrence, you mentioned about the 4 types of breast densities.
Mhm.
For females who have a dense breast,
Mhm.
they may be required to go in more often for screening than persons who do not have a dense breast.
No, actually, the screening guidelines, whether you're dense or not dense, are the same. The
Okay.
utility of the exam is different. So, for example, women who have dense breasts, the recommendation is that your mammogram should also be supplemented with a breast ultrasound. So, the ultrasound is an additional modality for you to evaluate the breast tissue to make sure you're not missing anything. So in women who have dense breast, you should advocate for yourself. It's a conversation with your clinician as to whether you would benefit from a breast ultrasound. And I often have women say, oh, I have dense breasts, I'm just going to get the ultrasound. The ultrasound cannot replace the mammogram. It has to be in addition to the mammogram because there's certain things that will show up on mammography that will not be evident on ultrasound. For example, if you have a cluster of microcalcifications, those are readily seen on mammography, which is more like an X-ray. And on the ultrasound itself, you perhaps most likely will not appreciate those fine microcalcifications.
Right. So,
Right. So see, Donna, I just proved my point. I just received a message from a very close friend, and she said, I wish I could, I'm reading this. She said, I wish I could hug you right now. My heart is full. I had no idea you had breast cancer. Thanks. She said, thanks God, you are on the other side of it and you're healing well. You look amazing. So she's on. She also said, I lost my sister to cancer 11 years ago, and I have been trying for years to create awareness about cancer in general. In fact, I started a book in memory of my sister and to honor. She says, please, I would like to have further convo with you on this. We need a bosom buddy here in Jamaica. Thank you for sharing your story. I am in the doctor's office with my son, and I am so filled with emotions. She says, bless you. And I love you, my sister. Now, we have to really remember that, and I said this, a few minutes ago, that we must have this conversation. It is very important. I found out, after my diagnosis, that there were many persons in my circle, close circle, that had breast cancer and quietly, went through the treatment and so forth by themselves. And now that I've gone through it, I don't know how they managed, because it's not really an easy thing to go through. But, and I'm not telling anyone how, they should, I'm not here to tell anyone how they should live their life, but I think that once you have gone through something like this, it is important for you to speak on it. Because you just never know. You never know who you might help by speaking on this, And Dr. Lawrence just rightfully said that this is nothing you brought on to yourself. It's it's nothing that you should be ashamed of. And it's, I think, keeping it a secret does more harm than good. You just never know who you can help by bringing awareness. You might have someone that is right next to you that is going through a difficult time right now, just received diagnosis, and by you talking about it, they now know that they can call on you for guidance. So, I'm going to ask our tribe out there that if you're going through something like this, to please find a way to reach out. Dr. Lawrence is, I don't know how she does it, but she is just the absolute best. If you receive a diagnosis and you're just home somewhere suffering, especially if you're in Jamaica and you have a question, you're confused about something. Because when I first received my diagnosis, I know I became just a cloud of fog in my mind. What do I do? And all these questions just, that I had. And if it hadn't been for Dr. Lawrence to call her, I Googled a lot, of course, but to call her so, there were persons that were telling me, oh, you need to drink this, or drink that. And so I called Dr. Lawrence, and Dr. Lawrence says, CG, you must have your surgery and we must do it now. And, so thank God that I listened to her. And, I am now on on the road to a full, just to go back to myself, to being on the road to being myself. There are times, of course, even now that, I feel a little nervous. The other day I felt something uncomfortable, and I called Dr. Lawrence and I said to her, I am feeling so-and-so. And she says, okay, she'll explain to me, if I should be feeling this, if I shouldn't be feeling that, and so forth. I have to close by saying this: screening is very, very important. Please, ladies, schedule your appointment for your screening.
Thank you so much, Consul General Wilson. You have shared with us your story, and I'm pretty sure, and I know it has inspired a lot. I'm inspired by your story, even learning it, a lot today. And based on the comments that I'm seeing, everybody is delighted. Even persons who didn't know, they are just amazed as to how you have carried yourself throughout this process, because the transition for you seems so easy, even though it was a task, but you made it your own and you did it your way. Dr. Lawrence, some closing comments.
Thank you very much for this platform to share my knowledge. And I want to commend Consulate General Wilson for sharing her personal story. I love storytelling. I think it's relatable. It is inspiring. And I hope that it's had a tremendous impact for those who may be listening as this event streamed this afternoon. But in closing remarks, we'll emphasize the importance of screening mammography, as well as your breast exam and seeking medical attention for abnormalities. And don't be hesitant to advocate for yourself. If you get an answer that is unsatisfactory, doesn't sit right with you, and you think that there may be something going on, it's okay to get a second opinion. You are your best own advocate. And I have patients who I see all the time who would say to me, Dr. Lawrence, we've really connected, but I want to get a second opinion. And they do, but they end up coming back for their care because what's been shared with them is the standard of care. But there's nothing wrong with you getting a second opinion. And if you see a clinician who has any objections or is offended by the fact that you want to get a second opinion, then I consider that to be a red flag.
Mm-hmm. Someone just asked a question: how easy it is to have a mammogram in Jamaica, especially in the rural area. I don't know. Dr. Lawrence, do you know the answer to that? How easy it is to have a mammogram?
I grew up in rural Jamaica. I'm from Somerton, St. James, and I will tell you, when I was residing there, the concept of screening mammography was almost non-existent. I suspect there has been some advances, but I cannot speak to today, here and now, how accessible it is for a woman to get a screening mammogram. So that's something for us to further explore as we move forward in terms of creating awareness, is that you also have to create accessibility.
Mm-hmm. Right. Yeah, so I think we can find out I think this young lady is in Jamaica, so we, Miss Brown, we can make a note of her contact, and we can get some answers for her.
Definitely, we'll give the information over.
Yeah. One of the things that I would like to do is, and Dr. Lawrence is aware of this, is to work, and we have started looking into this, as a matter of fact, to get some mobile units in Jamaica. Now that the young lady asked about the rural screening in the rural areas in Jamaica, I spoke to Dr. Lawrence about this already. And, we are working here to see if we can have, at least, they're quite expensive, actually. I was shocked when I found out that, the price for these mobile units. So we're working to see if we can acquire, at the very least, 2 mobile units to send down to Jamaica. And that will help to answer the question that she just posed about getting the screening done, especially in the rural areas.
Yeah.
Yeah.
All right, ladies, thank you so much. It has been an informative discussion.
Mhm.
Separate and apart from the one question, I think you have covered everything. Dr. Lawrence, thank you so much for taking time out of your day. I know you're very busy.
Yes.
For coming on here to be with us, talking breasts today. And this is a very important day, Mammography Day. And, you have given us so much to digest, and we can take away from it. So, ladies and gentlemen, I do hope that you have learned something here today, given the wealth of knowledge that was shared and the inspiring story of our Consul General. We owe it to ourselves to ensure that we maintain the balance both physically and mentally as it relates to our health.
Mhm.
It is often said that prevention is better than cure.
Mhm.
In the case of breast cancer, early detection does save lives. I am Donna Brown. Thank you, Dr. Lawrence. Thank you, Consul General Wilson. And thank you so much for participating in our program today. Do enjoy the rest of your Friday.
Thank
Bye
you
now.
so much.
Enjoy.
Thank you.
Bye-bye.
Thank you.